The dignity of the person. My thesis is the human life is to be respected from natural conception until natural death. Therefore, people should not participate in cloning, in vitro fertilization, gene therapy, and embryo reduction. In vitro fertilization. This process involves the destruction of embryos. When using in vitro fertilization, it destroys many embryos. If an embryo has any type of defect, it is immediately thrown away. In only about 1/3 of cases actually result in a successful pregnancy. It is unethical because it takes away the bond between a husband and wife to create life with a technical procedure that oftentimes fails and gives an embryo less dignity than it deserves. Freezing embryos. In the process of in vitro fertilization, multiple oocytes are taken from a woman at one time. All the extras are frozen until another one is needed. This does not give respect to the embryo because it increases its risk for death and because if an early try is successful, all the extras that are not used become orphans and are not used, which does not give them the chance for life. Embryo reduction. Sometimes in artificial processes, a multiple pregnancy can occur. This is when an embryo reduction occurs and the extra embryos are exterminated. This is immoral because it is the intentional killing of a human life, also known as abortion. Gene therapy. Gene therapy is the changing of genetics to avoid genetically based diseases. One example is somatic cell gene therapy. This process is to only cure the individual from a disease. Since the process seeks to bring genetics back to a normal state, it is seen as morally licit as long as there is no high risk involved. The other example is gene line therapy. This process seeks to change the genetics of the individual and offspring. This process is seen as more immoral because it would mean the use of in vitro fertilization and causes a significant risk for the offspring.